Good, happy Wednesday evening, December 8th, 2021. I'm Riley King. Welcome to this Wednesday evening edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Wednesday evening, so let's get started right now. First up, New Hampshire National Guard being deployed to help manage COVID-19 surge in New Hampshire, Governor says. Let's take a listen to that video from WR News 9.
Walmart, America's largest, is hiring. Earn up to $28 per hour plus benefits working at Walmart's distribution center. Get a $5,000 sign-on bonus, but hurry, you must be hired before December 16th. Apply today online or text DC to 240240. Walk-ins welcome.
So do we have like a little summary? I know that's a lot for folks, but it's important. I think it's really important for folks to understand some of the things that we're trying here. We're really putting a little bit of everything. This is a little bit of, we have a few slides that have kind of summarized all these different opportunities that we're trying to create. We have the additional vaccine vans. Those will be going out very shortly, I think, in the next few weeks.
Over the next few weeks.
Yeah, over the next few weeks. We have additional vaccine vans. They've been incredibly successful. Some of those vans can do hundreds of vaccines and boosters a day. We have the 4 new fixed sites that we have up and running. Again, Berlin, Plymouth, Rochester, and Claremont. Did I get that right? In Claremont. Those start, when's the first day that those start? Today? Yesterday? Tomorrow?
Several of them opened November 29th.
Oh, some of them have been open. Okay, great.
They have been open. The last one opens tomorrow.
Tomorrow. Okay, great. The last one opens tomorrow. So that's great. So those 4 sites are there. And again, putting about 1,500 vaccines a day out, 1,500 shots a day. The 1 million at-home tests, that's just a huge, I mean, to be the first state in the country to be able to do that and to provide the opportunity. And again, we're looking at doing that yet again. We should have some more information in the next week or so about if we can replicate that very successful at-home test program. We have our booster blitz. The Ida State Strike Force teams, and a big thank you to the Fiscal Committee and the Executive Council. They actually both did a fantastic job making sure they were moving quickly, moving as fast as the department needed them to move to respond to the crisis. So I give them, both those parts of the legislature and executive branch, a lot of credit for moving this stuff along. The licensure reform, when I heard 125 people are got their license today versus last week, that's a lot of staffing opportunity in hospitals with at least some expertise to provide some real quality health care to the folks that need it, as unfortunately our cases grow in our hospital. The 70 members of the National Guard is kind of a first phase deployment directly into hospitals, again, to take care of some of the additional, assist with some of the additional needs of the hospital so they can flex their staff a little more. And then one thing we've talked about a little bit, but again, that prepay guarantee, I don't know a better term for it, which basically says that folks that are waiting for their Medicaid eligibility to come through, we're guaranteeing those payments to the long-term care facilities and allowing them to move very, very quickly. They don't have to sit in those beds and wait any longer than they need to within the hospital settings. There's even more. There's another big one too. FEMA, I almost forgot. FEMA is, these monoclonal antibodies are absolutely fantastic if you get them early enough in terms of keeping folks out of the hospital. And all across the country, there is a lack of monoclonal antibodies. FEMA is sending us another 2,000 doses. We twisted a few arms down there. I don't like twisting arms. Sometimes when we do it, it actually works. But FEMA's been really great to work with over the past couple weeks, and they offered us an additional 2,000 doses of Regeneron to go with the monoclonal antibodies we're already using. The 30 paramedics into our hospitals, primarily around some of the emergency rooms, and then the FEMA deployment teams, 24 coming in this week, and maybe and hopefully more down the road, which is really great. So that's a lot. I know I'm throwing a lot out there at folks, but everything from testing to hospital flexibility, to long-term care flexibility, to the funds needed to pay for a lot of this stuff. The vaccine bans and ability to get the vaccines at a greater level. All of these are really important pieces to help manage the winter surge, which unfortunately is going to be with us for probably the next few weeks, or at least, if not a couple of months. We really just don't know what this is going to look like and what Omicron might look like, or the next variant. I have no doubt that Omicron, unfortunately, won't be the last variant we see, but we just need to be prepared. So.
Okay, there you go on that video and that report. Number of active COVID-19 cases, hospitalizations in New Hampshire set new record. Let's take a listen to that video from WMUR News 9.
Great, good afternoon. So we are reporting 1,184 new people diagnosed with COVID-19 today. Over the last week, we have averaged between 1,200 to 1,300 new infections each day, and there are currently 9,868 people with active infection. Our test positivity rate continues to be high. We're currently at around 12.3% of all tests, PCR and antigen tests combined, that are positive for COVID-19. And unfortunately, our hospitalizations and deaths have continued to increase. Currently, there are 462 people hospitalized statewide with COVID-19, and unfortunately, we have 11 new deaths from COVID-19 to report today, bringing the total number of people that have died from COVID-19 to 1,768 total individuals. 3 out of these 11 new deaths that we're reporting are in people associated or residents of long-term care facilities. And if you look at the last 7 days or the last week, there have been a total of 40 new COVID-19 deaths reported to public health. So we're averaging currently around 6 new people dying from COVID-19 each day in New Hampshire. As the numbers reflect, the levels of COVID-19 in our communities remain very high. Hospitalizations and deaths remain very high. And so it continues to be our strong recommendation that everybody 5 years of age and older get vaccinated against COVID-19. This includes children, teenagers, young adults, in addition to older individuals and people with chronic medical conditions. Just a brief update on the Omicron variant. There have still not yet been any Omicron variant infections identified yet in New Hampshire, but it is likely only a matter of time. We are doing the sequencing necessary to identify the Omicron variant, and Omicron infections have been identified in more than 50 countries around the world, including within the U.S. And within the U.S., there have been more than 21 states at this point that have identified the Omicron variant. So it's only a matter of time before New Hampshire also identifies the Omicron variant. We still have very limited data about this variant of concern, but there is some early evidence and some early studies coming out of South Africa that the variant may be more likely to cause reinfection in people who previously were infected with a different COVID-19 virus strain. And so it continues to be our recommendation, and it continues to be important for people who have been previously infected with the COVID-19 virus to get vaccinated. We know that vaccination provides more consistent and higher levels of protection than natural infection alone. And vaccination also protects against complications of COVID-19, such as hospitalization and death, and possible long COVID symptoms. We also have limited data on vaccine effectiveness against this new Omicron variant. But the pharmaceutical company Pfizer and BioNTech just made an announcement today of a laboratory-based study that found that a third booster dose of the vaccine offered increased and high levels of protection against the Omicron variant compared to people that only received the 2-dose primary series. Again, this is only a laboratory-based study. We haven't seen the full data on this. We are still waiting for real-world vaccine effectiveness data to come forward. But I think highlights the importance of everybody 18 years of age and older who has completed a primary vaccination series, whether that's a primary series with Pfizer, Moderna, or the Janssen vaccine, to get a booster dose in order to be optimally protected against COVID-19, including emerging variant infections. And so again, everybody 5 years of age or older should get vaccinated against COVID-19, including people previously infected, and everybody 18 years of age and older who has received a primary series should get a booster dose. And with that, I will hand things over to the Commissioner. Thanks.
Good afternoon. Very brief update. Our long-term care institutional outbreaks are staying about even. We are closing. We have 4 that have closed since our last press conference, and we're opening 5. So there's 24 total outbreaks in New Hampshire right now, so we're staying even, and we've seen that over the last couple of weeks. Thanks.
Okay, and there you go on that video. DHMC officials say 85% of COVID-19 patients in intensive care in New Hampshire are unvaccinated. Let's take a listen to that video from WMUR News 9.
Welcome to the Gigernet. Fidium Fiber has arrived. Say hello to better, faster fiber internet delivered right to your home.
Jan Dartmouth-Hitchcock says that hospitalizations across the state are 50% higher right now than they were at the worst point of the pandemic in December of 2020. New Hampshire is the least vaccinated state in New England. The numbers are different, though, depending on where you look. The CDC has the state at roughly 65%. New Hampshire's DHHS, that puts the state at 55%. Either way, some experts say that that number needs to be closer to 90%. According to the Dartmouth-Hitchcock experts, 42% of ICU beds in New Hampshire are being used for patients with COVID-related illnesses. 85% of those patients are unvaccinated. The capacity issues are having a major impact on critical care for other patients. Dartmouth-Hitchcock says they are about halfway through their 7-stage surge plan and are prepared to convert all possible spaces in the institution to care for critically ill if needed.
People who could have avoided hospitalization are occupying beds and taking resources that are needed by other critically ill patients, and all because they or somebody close to them refuse to be vaccinated.
It's really discouraging, disappointing, in that we actually have the tools that are needed to fight this pandemic, and yet, at least over the last month or so, we appear to be losing.
Now, unfortunately, Dartmouth-Hitchcock expects to see a high number of hospitalizations throughout the month of December due to the surges related to the Thanksgiving and Christmas holidays. Jason King, WMUR News.
Okay, and there you go on that video and that report. Man accused in Pelham church shooting seeks to suppress some potential evidence. Let's take a listen to that video from WMUR News 9.
Dale Holloway is looking to keep a couple of items out of his upcoming trial, including the gun that was allegedly used in the shooting. Dale Holloway is acting as his own attorney in the Pelham church shooting. Holloway is already serving 7.5 to 15 years in prison for assaulting his original public defender. He currently faces multiple charges, including attempting first-degree murder for shooting during a wedding back in 2019. That shooting allegedly happening just after the bishop told the couple he was marrying, "I now pronounce you man and wife." For over 2 hours this morning, Holloway attempted to show that the gun involved could have belonged to someone else, questioning Pelham Police Captain Ann Perriello, who was the first officer on the scene, about the fact that someone else handed her the gun and said it belonged to Holloway. It was a line of questioning he continued with a trooper from the State Police Major Crimes Unit.
Could it be possible that that magazine and that gun and those ammunition, those live rounds, those dead rounds in the projectile could belong to someone else? Is it possible that it could belong to someone else?
Yes. That was CNN.
Holloway is also seeking to suppress a statement that was given at St. Joseph's Hospital after the shooting. No word yet on when the judge will rule, but Holloway's trial is scheduled to begin in February. Reporting live in Nashua, Ray Brewer, WMUR News 9.
Okay, and there you go on that video and that report. Investigators reveal autopsy results for UNH student found dead over the weekend. Let's take a listen to that video from WMUR News 9.
Walmart, America's largest, is hiring. Earn up to $28 per hour plus benefits working at Walmart's distribution center. Get a $5,000 sign-on bonus, but hurry, you must be hired before December 16th. Apply today online or text DC to 240240. Walk-ins welcome.
Let's get right to that breaking news this noon about the death of a UNH student. Autopsy results just released show that Vincenzo LaRossi is the victim of an accidental drowning. LaRossi was reported missing early Saturday morning after a night out with friends. His body was found in a marshy area off Code Drive nearby. LaRossi was 22 years old.
Okay, and there you go on that video and that report. And that does it for this evening edition of the Riley King Newscast right here on the Riley King Network. Thank you for tuning in and watching. Have a great evening and see you back here tomorrow for another newscast. Good night and goodbye, everyone.